Spine. So I have put only the important things which can be asked in spine. So spine trauma is, first is spine trauma, there is stable injuries, unstable. So stable injuries can be managed conservatively. Unstable, you have to do decompression and fixation. The movement of spine is flexion, extension, rotation, translation, lateral flexion. Okay, that's why the patient, because it has all the movements, so patient have low back pain. It's the most common complaint. Mode of injury is fall from the height. Most common mechanism of injury is flexion. Site of fracture is D12 vertebra fracture. Now Jefferson fracture, fracture of C1 vertebra. Hangman fracture is fracture dislocation of C2 over the C3. Whiplash injury due to hyperextension. Clay shovel fracture is fracture of spinous process. So these all you have to remember these terms. Okay. Chance fracture, it is horizontal spine injury that occur when spine is flexed and distracted. Management of spine injuries, it is ATLS protocol. Log roll method, steroids. Now prolapse intervertebral disc, it is PIVD. So PIVD is due to compression of nerve due to disc bulge. Seen in posterior, most common is posteriorly, most common location L4, L4, L5, then L5S1. Predisposing factor is untrained young adult lifting the heavy weight. Okay, clinical feature, pain starting from the back, radiating to the limbs. Types is paracentral, lateral, and central. Diagnosis, straight leg raising test. Spondylolisthesis, vertebra slips over one another, which is most common location is L5S1. Spondylolisthesis, fracture is fracture in pars interarticularis. Spondylitis, inflammation of spine. In spondylolisthesis, slipping of one vertebra over another. Spondylosis, pars interarticular fracture. Scoliosis, lateral deviation of spine. Lordosis, spine bending of spine backward. Kyphosis, bending spine forward. Okay, so these all are important in spine. I am not going in details of all these, because if you remember all the fracture name and important terms, then you can solve any question of spine. Okay,